Morning, my name is Elizabeth, and I'm going to read to you my essay, which is titled The Causes and Effects of Cancer. Here we go. The Causes and Effects of Cancer. According to the National Cancer Institute, there are an estimated 215 cancers in the world. Liz Chabot, a reporter from USA Today, recorded a total of 18.2 million patients who have been diagnosed with cancer. Since cancerous patients' rates continue to increase, new studies have been tested in order to discover treatment for cancer. Two treatments that are responsible for being more effective in cancer research are chemotherapy and stem cells. The two most recent treatments have provided researchers with a greater understanding of cancer, including the sources and effective ways to prevent illness. Even though both treatments are effective, they are very complex and controversial. Cancer is life-altering, and people are diagnosed for some type of disease every day. Since the number of cancerous patients is increasing, the number of patients who get the treatment are also increasing. Today, about 1 in every 26 Americans have had cancer, reported Scavo. Cancer has become more prevalent due to unhealthy lifestyle people have. Cancer is a class of disease in which a group of cells display uncontrollable growth, innervation of essence tissues, and something metastasis, spread to other locations in the body. That said Carson Diswit. The graph to our left shows the projected increases for patients ever diagnosed with cancer from the year 2005 to 2020. 2020, yes. Cancer has increased over the past years due to causes such as genetics, smoking, radiation, viruses, alcohol, poor diet, and the lack of physical activity. Some researchers are worried that there won't be enough doctors for the number of incoming cancer patients. Cancer has taken the lives of many patients, starting to 114,886 deaths in 1930 to 556,902 in 2003. Due to preventions, early detections, and improved treatment, survival rates have increased. Cancers affected men and women differently because of different body reactions. Because of this, women tend to have a higher death rate than men. According to MedicineNet.com, breast cancer is the leading cancer for the woman in the U.S. Lung cancer is the second most common form of cancer. Prostate cancer is the leading cancer from the male in the U.S. It is followed by lung cancer. The most common cancer between men and women is lung cancer. The American Cancer Society's most recent lung cancer statistics in the United States for 2009, including an estimate of 166,900 men and 103,350 women, will be diagnosed with lung cancer, Cancer 101. This is a total of 220,250 people with lung cancer. The previous mentioned treatments, chemotherapy and stem cells, have helped to treat lung cancer in numerous ways. In the early stages of lung cancer, surgery is usually the first option to prevent the disease from developing in the lungs. If the cancer is too difficult to remove, the chemotherapy is often used. Chemotherapy is the use of strong chemicals or drugs to kill cancer cells, stop their reproduction, or slowly their growth. The first use of chemotherapy was in 1947. Medicines were first used to treat hereditary diseases. Later, they were used for more serious illnesses such as malaria, abies, trypanosomiasis, and Andreas Goth, an MD at the University of Texas Southwestern Medical School, explained. Through genetic engineering, scientists have been able to manufacture large quantities of anti-cancer drugs from natural occurring substances, including Inferno, a protein produced by animal cells. He included some diseases that interferon were used for, such as chronic myelogenous leukemia, genital warts, chronic hepatitis, malignant myeloma, and multiple sclerosis. Now that I've talk a little bit about my essay, I'm going to go to my presentation, which is in PowerPoint, and I'm going to present. So this is the cover page where it's like the whole information about. And then in the introduction, it says, what you're about to see are images about the causes and effects of cancer, the most affected cancer in the world, and the chemotherapy and stem cells that seem to almost cure any type of cancer. Now, in my essay, I talked about how in the medical center, they're talking about that for women, the breast cancer is like the worst cancer for women, and for the males, it's the lung cancer, right? So after talking about that, right here we can see about the chemotherapy, of how the drugs affect the body and like internal radiation and external radiation. And then down here we have, in this one, we have the chemotherapy and their benefits and risks, which I already talked about in the essay. And another cause and effect from my essay is talking about the brain cancer, which it can damage your eyesight. It can make it, you can go blind by it, depending on how like impact the tumor is or how big the tumor is. It also, you can lose balance, you can lose your memory, you can have amnesia, there's so many other symptoms. And here are like, in this picture, you can see like different type like muscle sensation, all different parts in your body. And then this is an example. These are examples of the stem cells. Like what are they? And they're inside your body, which is going to help you. As I said in my essay, that chemotherapy and stem cells right now are like, how can I say this? That's like our gateway to cure any type of cancer. And then the last image I have is still the chemotherapy, of how the tumor with the chemotherapy, it can reduce it, and also with the stem cells can reduce it. Now, in conclusion, well, I would say that this is a huge conclusion, but to like grab the most important parts. In conclusion, people that are dedicated to fight this cancer and to cure this cancer should still move forward, and we should still have faith, because with the new technology we have a more chance to get rid of the cancer than we used to do before. Furthermore, their program schedules include an awareness and risking component to educate patients, families, and community members about the cancer risk factors and the need to take care of prevention measures to avoid developing cancer. And these are some of the references I gathered for some of the